Hi, I'm Dr. Joe Cohen. I'm the medical director of HolosHealth and Journey to Life in Boulder and Denver, Colorado. I've been practicing cannabis medicine since early 2010 and am considered an expert in the field of cannabis medicine. Cannabis has been known to be used by different cultures around the world for thousands of years. It had medicinal qualities, and we knew this here in the U.S. People were required to grow hemp, which is part of the cannabis family of drugs, when this country was founded. It wasn't until 1937 that the Marijuana Tax Act was passed, and at that point, cannabis became illegal. In the 1960s and 70s, under the Nixon administration, they had the war on drugs, and it became a Schedule I drug. A Schedule I drug simply means it has no therapeutic value and that it also is highly addictive. Cannabis is the complete opposite of a Schedule I drug. Approximately 600 million years ago, the endocannabinoid system evolved through sea squirts and is now found in all animals on this planet. This is a system that was created for the purpose of keeping everything in balance in our body. It's all about balance and homeostasis. So we have receptors to these cannabinoids that we produce, and it turns out that the plant has the exact same type of compounds as what we produce, even though the plant didn't come into existence on this planet till about 25 to 50 million years ago. So we have this incredible system, and we have a plant that has the exact same compounds to try to help keep everything in balance. Once you understand the endocannabinoid system, even on its most basic terms, that's when you can start to understand why cannabis can treat so many different conditions in our body. So we have receptors in our brain. Our brain receptors are called CB1 receptors. We have receptors in our immune system. They're known as CB2 receptors. We have receptors throughout our body. Our brain has more CB1 receptors than any other neurotransmitter receptor in our body. In other words, we make all these neurotransmitters. They're dopamine, serotonin, glutamate. You may have heard all these names. And the reason for these neurotransmitters is to keep our brain functioning and to send signals to the rest of our body. Well, there's more CB1 receptors which connect up with our cannabinoids, the ones we make, which are called anandamide 2-AG, more CB1 receptors in our brain than any other neurotransmitter receptor. So we have receptors in our immune system as well, which in our immune system we're dealing with inflammation, and this is why cannabis tends to be a great anti-inflammatory medicine and can treat pain, inflammation, spasm, and a lot of issues related to pain. The receptors in our brain will attach some THC, which is the psychoactive part of the plant, and then you'll have the psychoactivity, the high that we get with cannabinoids. There's another very important cannabinoid in this plant, and that's called CBD, or cannabidiol. CBD is generally considered non-psychoactive. It does have anti-anxiety properties, and it does have a lot of medicinal value. As a matter of fact, many of us consider CBD to be the most medicinal part of the plant, and when combined with THC, it actually works extremely well. What happens is when you have psychoactivity from this plant, that is a THC effect, which is attaching to the receptors in our brain. There's a certain type of receptor in the brain, or a part of a receptor, that THC attaches to. These are the same receptors that our endocannabinoids, anandamide and 2-AG, bind to. CBD, however, binds to a different binding site on that receptor, and when it does that, it decreases the psychoactivity, it acts as an anti-anxiety drug, and the increased heart rate, or what we call tachycardia, that people get with THC. What we have done in our practice, though, is we've combined, for many of our patients with conditions, a combination of THC and CBD. And we find that to be most effective. It's incredible how these two parts of the plant work together. In our practice, we're seeing patients with a number of different medical conditions. We see cancer patients. Cancer patients may want to use this to treat the symptoms that they have when they're undergoing chemotherapy or radiation, or have had surgery, or have loss of appetite, etc. But we also have seen many, many patients in our practice who have actually been using it as a chemotherapy agent, and we always recommend that they use it in conjunction with whatever their oncologist or surgeon recommends. And we see cases like this all the time. We are using cannabis to treat autoimmune disease, and autoimmune disease affects 1 out of every 6 Americans. And a lot of this is due to the foods that we eat and what we've done with our food supply here. We are using a nutritional program along with cannabinoids because we know that CBD helps prevent, it's immunosuppressive, it helps bring down your immune system to a normal level. Cannabis is what we call an adaptogenic herb. It brings everything back to normal. When you take certain of these medications that you see on TV for autoimmune disease, what you're doing is you're bringing your immune system below normal, and then if you get an infection, your body can't fight it off. So cannabis is a much more effective and a much safer way to use this medicine to treat autoimmune disease and many other conditions. We see a lot of pain patients in our practice. Pain is the #1 indication for the use of cannabis here in the state of Colorado. As a matter of fact, 93% of patients who we see in Colorado are coming in because of pain. We see children here who have seizures, and we use strains that are mostly CBD and only add THC when necessary, and we find many of these children resolve a lot of their seizures or significantly cut down the severity and the frequency of seizures. We see its use in autism, even though that's not an indication. Many kids that we see here who have seizure may also have autism, and we're finding that it's actually helping them with their autistic behavior. There's so many different conditions that we see in our practice, and it's an amazing drug because it cannot hurt you. When used effectively and not overused or misused, it can treat a variety of conditions. Alzheimer's and dementia is the #1 cost of medicine in the United States today. We now are starting to realize that cannabinoids in both CBD and THC are actually neuroprotective. They protect the brain, they help grow new brain cells, and they actually help get rid of the amyloid beta plaque that we see in Alzheimer's. So there are a number of benefits to using the cannabis plant as a medicine. And all you have to do is research for yourself your medical condition and find out how cannabis, whether it be CBD or THC or any other cannabinoid, can help benefit you. Dr. Raphael Mechoulam, who is from Israel, discovered THC in 1964. He is still doing research in Israel and is coordinating with a lot of other researchers around the world. He has coined the phrase the entourage effect. What that simply means is that there's over 400 components to this plant. Some are known as cannabinoids, such as THC, CBD, CBC, CBG, CBN. There's over 100 of these cannabinoids, and there's not a lot known about so many of them because we've been restricted and prevented from studying this plant, but we're learning more and more as time goes on. In addition to our cannabinoids, we have flavonoids and we have terpenes. Terpenes are what give flavor and odor to cannabis. In other words, when you smell the cannabis plant, they'll smell different, and that's because they have different terpenes in them. And these terpenes actually modulate the effect of cannabinoids. So they actually change the way the cannabinoids actually work in your body. Try using certain types of strains, such as an indica strain, which is known to give you the couch lock, help you sleep at night, reduce pain, or a sativa strain. And sativas are more daytime, awake, alert, creative. You may have the same cannabinoid structure, but you may have completely different terpene structure. So, and the terpenes actually modulate the effects and give you a whole different effect from the strain that you're using. There are several different ways that you can consume cannabis safely. So what I'd like to do is discuss with you the different delivery systems and give you an idea what you might want to use in certain situations. First of all, we'll talk about inhalation, and there's about 3 different methods of inhalation. Number 1 is smoking, which we've all known about for years and years. The old-fashioned way, we use a pipe, a cigarette, or a bong. The second is to vaporize flower, which is the bud that we get when we usually go into a shop and buy our marijuana. And the third way is to vaporize concentrated oils. So I'm going to discuss a little bit about each. The downside of smoking is that you're going to get carcinogens, very similar to what you would get in cigarettes. You get odor, cough, congestion, sinus problems. So there's several downsides to actually inhaling smoke, which is why we recommend vaporizing flower, because it eliminates all the negative side effects. So you can safely inhale without getting any of these negative aspects of smoking. The great part about inhalation is that it's fast-acting and short-acting. Fast-acting because it works within 2 minutes, it peaks in about 10 minutes, and it only lasts about 2 hours. I think this is an advantage rather than a disadvantage. And the reason I say that is you can time your doses to work better in your life. The second method I want to address is tinctures. Tinctures are drops that go underneath the tongue. They come in a variety of different forms. You can get tinctures that have mostly THC, mostly CBD, combinations of both. They're also nice because they work in about 15 to 20 minutes and they last for about 4 hours. For new users, tinctures are a great way to go because they're so easy to dose and they're very convenient. Another method which we've all heard about are ingestibles, or what we call edibles. I call them ingestibles because it's not just the brownie or the candy, it's also the tablet or the capsule or the drinks that we get. They're all ingested, meaning they have to go through your GI tract, your small intestine, into your liver and be converted into a different substance. And when that happens, it takes about an hour to an hour and a half to have the effect. So it's a delayed onset, but it's long acting. So you have to be very, very careful when you dose an ingestible. We always say start low, go slow. Start with a 5 milligram dose. See how you do with that, and then you can go up or down from there. But it's going to last a long time, so you want to test the waters with ingestibles when you don't have to get behind the wheel of a car and you don't have to operate heavy equipment. Use ingestibles safely. The other method that I wanted to mention is topicals, which are going to be salves. They're a local effect. In other words, you would apply it to, say, your neck is in spasm, you're having neck pain or low back pain or joint pain. You would get a topical marijuana and you would apply it to that area, and it has a local effect. It's not systemic, it's not going to cause you to get high. You'd have to have a whole body massage with that to get high. But it will have a local effect and help reduce your pain. What we find best is you apply a topical, say if you're having muscle spasm, and massage into the area such as your neck, put some heat over it, and it'll melt your muscles and you won't get high at all. Another method is transdermal, which are going to be your patches. You would put a patch on the dorsal part of your wrist as an example, and when you do that, you're actually going to have an effect fairly soon, and it'll last as long as you leave it on the wrist, up to about 8 to 12 hours. The problem with some of these are that they don't get absorbed properly or they can cause a rash. So there are many different ways that you can use this medicine effectively, and you have to time it to what you're trying to treat and when you're trying to use this medicine. So thank you for watching. I hope you've learned a lot about this amazing plant, and please use it responsibly.